Before you move on, give me a minute. There is a part of cancer prevention that often gets pushed to the side, and not because it is unimportant. Usually, it is because office visits are short, people are overwhelmed, and the conversation turns to whatever problem is already on the table. But some of the habits that seem the most ordinary are the ones that matter most over time. I'm Dr. Whitfield. For more than 30 years, I've been looking at one question from different angles. Why do some adults develop cancer later in life, and why do others never do, even when they seem to have similar family histories or similar bad luck? The answer is not just one thing, of course. It never is. But one pattern keeps showing up. The strongest protection against cancer is often not a drug, not an imaging test, and not some rare genetic gift. It is daily behavior. Repeated, quiet, easy to overlook behavior. A large Harvard T.H. Chan School of Public Health study followed more than 120,000 adults for over 20 years. The finding that caught my attention was simple and hard to ignore. People who kept up just 5 specific habits lowered their risk of major cancers by as much as 65%. Not a tiny shift, a very large one. In that group, close to 2/3 of cancers appeared to be potentially preventable. That does not mean control over everything. Medicine is never that neat. But it does mean prevention has more room in it than many people have been led to believe. I'll mention something now because it tends to surprise people later. The habit that comes in first on this list is something many adults over 60 gradually let go of. Some think they are too old for it. Some were told, gently, to slow down and be careful. Caution matters, yes, but the research here goes in a direction many people do not expect. Before I walk through the 5 habits, I'd like to ask you something. If you want, leave your age in the comments. Just your age is fine. And tell me whether any doctor has ever talked with you specifically about cancer prevention habits, not just tests or treatments or what your lab work already showed. I do read the comments. They help me understand what people are actually hearing in the exam room and what they aren't. So let's go through these one at a time, starting at the 5th and working up. The 5th habit is probably sitting in your kitchen already, and because it sounds almost too simple, people tend to shrug it off. But after 50, one of the most important background drivers of cancer is chronic inflammation. Now, inflammation by itself is not the villain. If you cut your hand or twist your ankle, inflammation is part of repair. It is your body showing up to clean the area, contain damage, and start rebuilding. Useful. Necessary. The problem begins when that response never fully switches off. Then, the same system that is supposed to help starts irritating healthy tissue instead. You may have heard the term inflammaging. It sounds like a made-up wellness word, but it refers to a real pattern, the low-grade inflammatory burden that tends to rise with age. That burden is linked to many chronic diseases, including cancer. Researchers at UCLA reported that people who consumed turmeric daily, especially its active component curcumin, had measurable reductions in inflammatory markers after about 12 weeks. One of those markers, interleukin-6, dropped by as much as 37%. Interleukin-6 is one of the signals that keeps inflammation humming along when it should have settled down already. Why does that matter more as we get older? Because after about age 65, the body's own anti-inflammatory systems become less efficient. Enzymes that once neutralized inflammatory compounds slow down. Cellular housekeeping gets less sharp. Precancerous changes can slip by more easily than they did decades earlier. Curcumin seems to help by dampening a pathway called NF-kappa B. You do not need to memorize the name. The practical meaning is that it interrupts one of the signals cells use to drive inflammation forward. It is a little like lowering the volume on an alarm that has been blaring too long. In everyday terms, the amount used in many studies is about half a teaspoon of good turmeric powder a day. You can add it to eggs, soup, rice, beans, or stir it into warm milk in the evening if that suits you. Some people put it in oatmeal. I'm not going to pretend that is my favorite version, but people do. One detail matters quite a bit. Black pepper. Pepper contains piperine, which can increase curcumin absorption dramatically, up to 2,000% in some estimates. Without it, a lot of curcumin simply passes through the body. With it, more of it is actually available to do anything useful. It also helps to take turmeric with a meal that includes some healthy fat, because curcumin is fat soluble. I remember a patient named Linda, a woman in her 70s, who came in worried after another colonoscopy showed a precancerous polyp. We talked about the bigger picture, diet included, and one of the changes she made was using turmeric with black pepper every day. Not as magic, just as one part of a more consistent routine. At a later follow-up, things looked better than she had feared. She still talks about her evening turmeric drink as if it were some family recipe she discovered late in life. If that fifth habit helps calm one major source of damage, the next one supports something your body cannot do well without. The fourth habit is careful, regular exposure to sunlight. That topic has confused people for years, and for understandable reasons. Skin cancer is real. Sun damage is real. But that does not mean all sun exposure is harmful or that avoiding daylight altogether is a good strategy, especially later in life. I'm talking about brief, intentional time in natural sunlight to help the body make vitamin D3. And yes, I know some of you take a supplement already. That may still make sense. But sunlight and a pill are not exactly interchangeable in the way people sometimes assume. A study from UC San Diego followed over 1,500 women for 4 years and found that those with the highest vitamin D blood levels had a 67% lower cancer risk than those with the lowest levels. Another analysis published in the British Medical Journal and based on data from more than 95,000 people found that for every 10 nanomole per liter increase in circulating vitamin D, overall cancer mortality fell by about 4%. That is meaningful, very meaningful. Vitamin D acts more like a hormone than a simple vitamin. It influences the expression of more than 200 genes, and many of those genes are involved in cell growth and cell division. That matters because cancer begins when normal control over cell division starts to break down. The trouble is that aging skin becomes much worse at making vitamin D from sunlight. By age 70, the skin may produce roughly 75% less vitamin D from the same sun exposure than it did at age 20. So older adults are often both more deficient and more affected by the consequences of that deficiency. The practical habit is modest. About 15 to 20 minutes of direct sunlight on the arms and legs, ideally sometime between 10 a.m. and 2 p.m., 4 or 5 days a week, not through a window. Glass blocks the UVB rays needed for vitamin D production. You need actual outdoor light on your skin for that short period. This is not advice to bake in the sun or stay out long enough to burn. Quite the opposite. Short and consistent is the point. There is another piece people miss here, and it is magnesium. Magnesium helps convert vitamin D into its active form inside the body. If magnesium levels are low, the vitamin D you make or take may not be used properly. That is one reason some people supplement for years and still do not get where they need to be. Pumpkin seeds are a decent food source. A magnesium glycinate supplement in the evening is another common option, depending on your situation. And if getting outside is hard because of mobility or climate or where you live, a vitamin D3 supplement in the range of 2,000 to 4,000 IU daily can be a reasonable alternative. But it is smart to check your blood level first. Guessing is not the best way to do this. The studies I'm mentioning are listed in the description below. If you like reading the original papers, they're there. Now, before we go on, a brief aside. If these videos are useful to you, subscribe to the channel. We put them together for adults over 50 who want clear, practical information without too much nonsense wrapped around it. And if someone in your family would benefit from this, send it along. A brother, a spouse, an old friend from church, whoever comes to mind. Also, a like helps more people see it. That part is unglamorous, but true. The third habit has to do with your gut, and I still think a lot of people are not hearing nearly enough about this from their doctors. Your digestive tract is not just a food processing tube. It is one of the central hubs of your immune system. Roughly 70% of immune activity is tied to the gut. Inside the intestines live trillions of organisms, bacteria, fungi, other microbes, together called the gut microbiome. That community affects inflammation, immune signaling, metabolism, and the body's ability to notice abnormal cells early. A 2022 paper in Nature looked at the gut microbiomes of more than 1,400 cancer patients across several cancer types and found that certain beneficial organisms were greatly reduced compared with healthy controls. Researchers at MD Anderson later identified that patients with strong levels of particular bacteria, including Akkermansia muciniphila, tended to have better responses to cancer immunotherapy. In other words, the microbiome is not just a passive bystander. It seems to help shape how effectively the body responds. As people age, gut diversity usually drops. Beneficial species thin out. More inflammatory species can begin to dominate. This shift, often called dysbiosis, can weaken the gut lining and allow inflammatory compounds to pass into the bloodstream. People often call this leaky gut. The term gets overused online, but the underlying idea is real enough. A disrupted gut barrier can keep systemic inflammation turned on. And again, chronic inflammation creates the kind of internal environment cancer tends to like. The daily habit here is not complicated. 1 to 2 servings of fermented food each day has been shown in a Stanford clinical trial to improve microbiome diversity within about 10 weeks. That means plain yogurt with live cultures, kefir, kimchi, sauerkraut, or miso. These foods introduce beneficial organisms directly and also help generate short-chain fatty acids, which nourish the cells lining the intestines and help maintain the gut barrier. If you are not used to fermented foods, go slowly. A 1/4 cup of plain kefir in the morning is a reasonable place to start. After a couple of weeks, maybe move to a 1/2 cup and add a spoonful or 2 of sauerkraut with dinner. If people jump in too fast, they sometimes get bloating and then decide the whole idea was a mistake. The other part of this, and maybe the less glamorous part, is prebiotic fiber. Beneficial bacteria need something to feed on. Garlic, onions, leeks, asparagus, and slightly underripe bananas are all good sources. Think of fermented foods as bringing in the workers and fiber as giving them lunch. Not a perfect analogy, but close enough. A man I once saw, Frank, late 60s, always looked mildly annoyed by his own digestion, started doing something very simple. Kefir most mornings, a little sauerkraut with dinner, raw garlic and homemade dressing when he could stand it. Within a few months, his inflammatory markers had improved substantially. At his next yearly exam, his physician commented on how much better the labs looked. Frank said, "It's the sauerkraut," which made everybody laugh except Frank. He was quite serious. The second habit is the one many people dismiss too quickly, not because it is unimportant, but because they assume it no longer applies to them. It does. Resistance exercise is one of the strongest daily tools we have for cancer prevention after 50. By that I mean using your muscles against resistance, weights, bands, body weight, or machines for around 20 minutes at least 4 days a week. I know the objections: bad back, arthritic hands, one knee that has had enough, a diagnosis of osteoporosis. Feeling that this kind of advice is for people 20 years younger. I hear those concerns all the time, but here is what the research says. An American Cancer Society analysis published in 2023, using data from more than 1.4 million adults, found that regular resistance training was associated with a 28% lower risk of colon cancer, a 31% lower risk of kidney cancer, and a 25% lower risk of bladder cancer. Those are not tiny differences. The reason has a lot to do with muscle itself. After age 50, most people lose about 1 to 2% of muscle mass per year. That process is called sarcopenia. People often think of it in terms of strength or appearance, but muscle is metabolically active tissue. It is not just there to move you from the sofa to the mailbox. When muscles contract, they release signaling compounds called myokines. These compounds help lower inflammation, improve insulin sensitivity, and support immune surveillance. Some research suggests they also help suppress tumor growth. So when muscle mass declines, part of your anti-cancer defense system declines with it. You can think of it as losing a patrol force. Less muscle means fewer of the signals that help the body monitor trouble early. Resistance training is the best studied way to slow or reverse sarcopenia in older adults. Tufts University studies have shown that even adults in their 80s and 90s can gain meaningful strength and muscle after only 8 weeks of regular supervised training. Not everybody needs a gym, but almost everybody needs some version of muscle work. If you have never done this before, start with a chair. Sit down and stand up 10 times in a row, 3 times a day. That is legitimate resistance exercise. It works the thighs, hips, and core. It may not look impressive, but it counts. Resistance bands are another good next step, and they are inexpensive. Most sporting goods stores carry them, and you can use them at home without much space. Over time, the idea is gradual progression. The body adapts, so the work has to become a little more demanding as you get stronger. That does not mean punishing workouts. It just means the muscles need a reason to respond. A pleasant walk is excellent for many things, and I recommend it often, but it does not replace resistance training. Now, one practical detail that matters: protein after exercise. Researchers at the University of Texas Medical Branch found that older adults tend to build muscle more effectively when they get about 25 to 30 grams of high-quality protein within 2 hours after resistance exercise. This becomes more important after 65 because of what is called anabolic resistance. Older muscle needs a stronger signal to rebuild. Greek yogurt, eggs, salmon, cottage cheese, a whey shake if that works for you, those are all reasonable options. As for time of day, the best time is the time you will actually keep doing. Still, if your schedule is flexible, late morning often works well for older adults. Energy tends to be steadier then. Recovery is often better too. And that brings us to the first habit, the one that ties the others together more than people realize. The most powerful daily habit for cancer prevention after 50 is sleep. Not fancy sleep gadgets, not herbal sprays for your pillow, actual sleep. Consistent, good quality, protected sleep, 7 to 8 hours a night, on a fairly regular schedule. Some people are disappointed when I say that. They expect something hidden or exotic. But the reason sleep is so often underestimated is pretty plain. There is not much to sell around it. Prevention that depends on routine and environment usually gets less attention than prevention that comes in a box or bottle. The evidence here is strong. A study in cancer epidemiology, biomarkers, and prevention followed more than 180,000 adults in several countries and found that people who usually slept fewer than 6 hours a night had a 55% higher risk of colorectal cancer, a 44% higher risk of breast cancer in women, and a 70% higher risk of prostate cancer in men, compared with people who routinely slept 7 to 8 hours. That is a large difference. Why would sleep matter so much? Because deep sleep is when a great deal of repair occurs. During that stage, the brain activates the glymphatic system, which clears metabolic waste and inflammatory debris from brain tissue. The immune system reaches peak production of natural killer cells, the white blood cells that help identify and destroy abnormal cells. Growth hormone is released. DNA repair enzymes become more active, working through the small daily errors that build up in all of us. After 60, sleep architecture changes. People spend less time in slow-wave deep sleep, which is the phase where much of this repair happens. Melatonin production also drops by as much as 70% compared with younger adulthood. And melatonin is not only a sleep signal, it also acts as an antioxidant, helping protect DNA from oxidative damage. So the goal is not simply more time in bed, it is protecting the quality of the sleep you get. The basics are not glamorous, but they work. Keep the bedroom cool, ideally under 68 degrees Fahrenheit. Body temperature needs to fall a bit for deep sleep to begin. Remove artificial light from the room, including the small standby lights on chargers and electronics. Even low levels of light can suppress melatonin. Try not to eat within 3 hours of bedtime because digestion raises body temperature and can interfere with the transition into deep sleep. And keep your wake-up time consistent, even on weekends. That one is harder for people than it sounds, but your circadian rhythm depends on regularity. When the schedule swings around every Friday and Saturday, the body experiences a kind of mild time zone shift. Researchers call it social jet lag, and it has been linked independently with greater cancer risk. Something else worth mentioning, the habits we already discussed support this one. Resistance exercise improves sleep quality in older adults quite reliably. A meta-analysis in Sleep Medicine Reviews found improvements of up to 65%. Lowering inflammation with turmeric may help stabilize sleep architecture. A healthier gut microbiome contributes to serotonin production, and serotonin is the precursor to melatonin. So fermented foods, oddly enough, may help you sleep better too. The body likes systems that cooperate. It usually does not work in isolated compartments. There was a woman named Nancy, mid-70s, who spoke with me after a community event a while back. She had been treated for early breast cancer and was in remission, but she was deeply afraid of recurrence. Sleeping maybe 4 or 5 hours most nights, lying awake and waiting for the next bad thing. We talked for 15 or 20 minutes about what sleep is actually doing in the body, the immune surveillance, the overnight repair, the role of melatonin. She later called the office to say she had finally started treating sleep as part of her recovery instead of an afterthought. Months later, she said she was resting better than she had in years. Her doctors were pleased with how things were going. More than anything, she sounded less at war with her own body. That matters. So let me leave you with this. If you are in your 60s, 70s, or beyond, you have not aged out of prevention. You have not missed the window. The body continues to respond to the right signals for much longer than people think. Even at 75, even at 80. Not perfectly, not endlessly, but meaningfully. The 5 habits we covered, using turmeric with black pepper to help control inflammation, getting regular sunlight to support vitamin D, eating fermented foods to rebuild the gut microbiome, doing progressive resistance work to preserve and restore muscle, and protecting deep regular sleep, are not a cure and not a guarantee. They are a way of living that supports the systems your body already uses to defend itself. You do not have to choose between getting older and getting stronger. Those things can happen together. After all these years in medicine, some of the best advice I can give still sounds almost too plain. Start taking care of the body you have now in the small, repeated ways that add up. That is often where the biggest change begins. If this was helpful, subscribe to the channel. We put out new videos each week for adults over 50 who want information grounded in real research. If you have a moment, click like as well. It helps more people find this. And leave a comment telling me your age and which of these habits you are most likely to start this week. I am always interested in what people feel ready to change and what still feels hard. The studies mentioned here, the Harvard cohort study, the UC San Diego vitamin D work, the Nature microbiome paper, the MD Anderson findings, the Tufts resistance training trials, and the sleep research are linked below the video. Read them if you want. Ask questions. Stay curious about your own health. That curiosity is useful. It tends to lead people toward better choices. I'll see you in the next video. Take good care of yourself. This video is for informational purposes only and does not replace professional medical advice.